Okay. Good evening. Welcome to another episode of the Flurry Care Digest, wherever you're watching from. We're super excited to be with you again. Today, we have the privilege to be speaking to the medical director of eDoc Healthcare Services in Zambia, Dr. Vera. Good evening, man. Welcome to Flurry Care Digest.
Good evening, and thank you for having me.
No, it's quite a privilege to actually have you here. So I was just going through some of the things that you've done, and I also realized, like myself, well, today you're based in Zambia, but before now you're actually based in Canada, living overseas a little bit. How was life as an immigrant like for you?
Hmm. Loaded question. Um, I've lived out of Zambia since 1990. I guess you could say initially when I left, I was an economic refugee. So my family and I moved, or myself and spouse moved to Lesotho. Did a stint in Lesotho, then moved to South Africa in 1994. Worked in South Africa, did residency there, having attained my Bachelor of Medicine in Zambia. I did residency in South Africa, and then in the year 2000, we decided to move to Canada. Canada, or living overseas, should I say, or out of Zambia, has been quite an experience. Um, I think I feel blessed that I was able to do that. I was exposed to different cultures, which I enjoyed. But the other component is you are separated from family, you're separated from home. There's a lot of stressing and worrying about the family back home. You get phone calls that come in about people who are sick. You get phone calls, about funerals. You can't travel. So that's the stress that comes with living overseas. But overall, it was a good experience. I've lived out of the country for over 35 years and I've enjoyed it. But decided to come back home in 2021. So finally finished my transition last year in October.
Yeah,
Yeah.
and I think it's a transition that we've also been blessed with here at Flurry because we had the privilege to be working with eDoc. So
Mhm.
for our listeners, for just the sake of our listeners, tell us a little bit about eDoc and what you're trying to build at eDoc and why should people listen to the story behind eDoc Healthcare.
Okay, thank you. eDoc was actually conceived, if I can call it that, in March of 2021. It was sort of when COVID peaked. The worst of it was in 2020, as everybody knows. By March 2021, we were in Canada anyway, we were sort of getting out of the quarantine and starting to mingle with people. By the time we'd gone through COVID the first year, myself and the co-founders, who happened to be, we all were in Canada. Two of us were physicians, myself, medical director, Dr. Mtambo, who is the managing director, Mrs. Mtambo, who is the nursing director, and Mr. Muhongo, who is the administrative director. So all of us kind of talked over the phone initially and then got together and decided, you know what, during COVID, we've noticed that there's been a lot of calamities back home, if I can call it that, people that have had medical emergencies or even just regular checkups were being missed because of the fear of attending hospitals, the fear of getting infections, fear of getting onto public transportation, et cetera, et cetera. So we thought to ourselves, we've been working with, during COVID, doing remote work, so telemedicine. We've witnessed how services were taken to people's homes, of course, making sure that we take precautions so that we don't get infection or infect people. So if this was happening where we were working in Canada, why not bring it to Zambia? Each of us were affected family-wise, friends-wise. So we decided to bring it to Zambia, and that's how by 2022 February, we actually launched eDoc Healthcare Services. So eDoc Healthcare Services is an organization, a health organization that provides telemedicine, but we also provide home health care. And the home health care is quite broad. It involves nursing care, it involves physiotherapy, it involves palliative care, some counseling. And the beauty is all these services are actually taken to the patient in their own home. So the patient does not have to leave home to obtain services from us. We go to them and take the services there. And the emphasis, of course, is on quality healthcare services. And that's what we stand for.
No, I think the journey and the vision of what we're trying to cover at eHealth, eDoc, sorry, is just really remarkable. But you mentioned telemedicine, right? So I think in 2022, the remittances in Zambia was about 1.2 billion around that, and then it represented 3.1% increase. So it means a lot of Zambian living overseas send money back home. But then when you look at those data cumulatively across the continent itself, we've seen data that says up to 83% of that spend is actually quoted for healthcare. So how has eDoc, leverage of telemedicine position itself to be able to support members in the diaspora to be able to take care of their family back home a little bit better than just sending money back home?
So I would say actually COVID is actually what spurred eDoc. And the recognition that people were struggling to get quality healthcare. So that spurred us on. And right now, what we try to do is partner with people that will help us to get it out in the diaspora that there is a service here in Zambia that will give your loved ones healthcare, whether it's in emergencies or urgent situations, or even if it's in a situation where somebody is concerned about their mother or father or sister back home. Maybe she's sounding different on the phone and she doesn't really explain what's going on. We can be your eyes in the community. We can check on your loved one, let you know what's going on, of course, with consent from your loved one, and then also put in the services that your loved ones need. So yeah, COVID actually spurred us on. It was part of the reason why eDoc was born, and it's what's keeping us going partly. Of course, now that COVID has settled down and changed from a pandemic to normal in the community, we still find that people now are appreciating telemedicine, appreciating home health services much more than they did when we first launched. So, yeah.
No, the reason why I asked that question specifically is because majority of the people that actually bear the cost of healthcare is um, immigrants, people that actually live overseas. So they bear this burden, right? So with the introduction of technology and being able to coordinate care a little bit more seamlessly, it's quite that services like eDoc are available to the people of Zambia, but also provides the incentive for people living overseas to actually be able to get access to really quality care, as you mentioned, for their families, because that's quite essential. But I want to touch a little bit about your preventive care. You mentioned that also as part of the things that you do at eDoc, you also work on preventive care. So we normally prevention is better than than
Then
cure.
cure. Yeah.
So
Yeah.
tell us a little bit about how you operate your preventive care, especially post-hospital care. How do you look at that, and how do you go about your promotion of or providing of healthcare education, especially in the preventive care space?
Okay. Firstly, I would like to say we appreciate as eDoc the fact that we feel privileged that we were able to partner with Flery because as far as people in the diaspora are concerned, it's not easy to get the word out there that this service is available. But now that we've partnered with Flurry, we are quite confident that that will bridge that gap and help people in the diaspora to reach out. Um, as far as the preventive component, we have two aspects, if I can say that. One of them is we provide what we call a chronic disease management program. Now, chronic disease doesn't necessarily mean disease, but illnesses. And a lot of these illnesses that are chronic, that are long-standing in patients, I'll give an example of diabetes or high blood pressure or kidney failure. Conditions like that, they can actually be prevented or delayed if a patient is aware that there are complications that can happen, and if the patient is aware that they can actually put in measures to either delay or actually prevent these conditions from happening. We come in where this chronic disease management program involves us seeing these patients, talking to these patients at regular intervals. The intervals, of course, are predetermined based on studies that have been done. So it's evidence-based studies. And us coming in and seeing these patients at particular intervals, we not only check them at that time, but also educate them about their condition, educate them about potential risks, educate them about the trajectory of the condition and how they can play a role in slowing it down or preventing those complications. So these chronic disease management program, we offer it to patients who have long-standing illnesses. We also, in that vein, also talk to them about medication or lifestyle changes. We talk about diet. So a lot of things that will impact someone's health going forward if they have a chronic illness. That way, we're preventing deterioration, we're preventing complications, we're prolonging life. The other component is eDoc is very active in offering education to the community. So we are doing health talks. Sometimes we're called upon by insurance companies, some of whom we've partnered with. They call upon us to give educational talks to their corporate clients. So they'll ask us perhaps to come and talk about hypertension. What causes it? How do you prevent it? How do you live with it? How do you prevent complications, etc.? So we go in and give these health talks free of charge, hoping to help the community at large prevent illness, but also prevent complications. So these talks are done at request, by request of the companies, but we also have social media where we have on our platforms quite regularly, we post information about health. So we post information about how to prevent certain conditions, how to live with certain conditions, what to look for when you have a condition that may deteriorate. So in that way, we are actually offering preventive medicine, so to speak. We're also involved in things like immunizations. So if little children, sometimes parents are not able to attend clinics for vaccination, we can vaccinate them. Older patients, a lot of patients are not aware that actually vaccinations don't stop when you're a kid. You get vaccinations as you grow older. So we try to educate patients about this, and we offer those vaccinations to them. Yeah.
Yeah, I mean, just listening to that. So one of the things that is quite essential, especially both in prevention, well, mostly in prevention, is the power of collaboration, right? Because
Mm-hmm.
you have to be able to align with not only with government organizations, like you said, but also other stakeholders that are involved or have the same looking at the same outcomes from some of this work. So yeah, tell me a little bit about collaboration and how it looks like. I know that in the African context, it's usually something that is very exciting, but I'm very keen to explore that conversation because I feel like um, as pioneers or change agents, especially in this space, given the general health outlook of the continent itself. We need more people collaborating, right? More people engaged,
Mm-hmm.
active collaboration, not only collaborating, but engaging in active collaboration and being able to actually push for a singular outcome, which is more healthy, healthier people, more or
Yes.
less. So tell us a little bit about collaboration. How are you achieving working with alignment and working and achieving the mission of the national mission with the Zambian ministry, um,
Mhm.
government ministry, but also how do you align working with developmental partners and how do you work with people like us? How is that process like for you?
Okay. So the Ministry of Health here in Zambia, um, they they stand for equitable access to cost-effective, quality healthcare services which are close to family and provided as much as possible in a caring and competent environment. We have aligned ourselves with that. We provide those services to the patient, close to family. We're competent, we're caring, the environment is comfortable for the patient. We're also cost effective. It actually is much more cost or is cheaper to receive care from eDoc healthcare services in the home than it would be to go to a private brick and mortar clinic, not public, but private. So we're working on that. We're working with that. In terms of collaborating, we've collaborated with hospitals in the country. Initially, of course, it's within Lusaka because being a new company, we're mainly based in Lusaka for in-person care. So we've collaborated with hospitals with whom we are excited to say that we can refer patients when there are complications or when there's a need for inpatient care. It's a much more seamless referral than if you don't collaborate with hospitals. We've collaborated with labs here in Lusaka, so laboratory services, some of which actually go to the client's home to either pick up samples or to take samples from the patient. There's a lab we collaborate with that actually goes into the home and does an ultrasound of the heart, for instance, or they'll do an EKG of the heart. So that makes it easier for the patient to receive quality services within their home, again, lining up with the mission of the Ministry of Health. We've partnered with pharmacies. So the pharmacies, some of them do delivery of medications to the patient's home. And we now are able to request a prescription for a patient during consultation, either provide it to the patient online or send it into the pharmacy. And the pharmacy will fill that prescription in a timely fashion and deliver it to the patient if they so wish. There's a facility that also does medical imaging that we've collaborated with. Again, it's easier for the patient if I recommend a CT scan and make the pathway seamless for the patient, communicate with the imaging facility. Before you know it, the patient is in, gets their test done, results are sent to me. So that type of collaboration helps to deliver better quality care to the patient. It's more timely, it's more efficient. So that's how we're collaborating. And then, of course, we've lobbied with insurance companies because we know a lot of patients have insurance. So health insurance covers their needs. And if we collaborate and make sure we provide services to patients who are insured and they can claim for their insurance, that also furthers the agenda. And then there's organizations like Fleury. We are reaching, I'm happy to say, areas outside of Lusaka, outside of Zambia, and helping people in the diaspora who want to help their relatives here in Zambia, but sometimes it's very tricky to actually find the right resource person, find them in a timely manner, and make sure that that person will give the quality of care that they would like for their loved ones. So partnering with organizations like yourselves is another way that we're collaborating and making sure that we're meeting our agenda. Yeah.
So, yeah, one of the things that is very crucial, especially with partnership in the healthcare space, is how you actually are able to consistently manage quality across the board. So quality of so people go to eDoc because they know eDoc has a certain standard. But then when you work with third-party providers, they are not necessarily the one validating that quality. eDoc is
Mhm.
validating that quality on their behalf. So how do
Mhm.
you ensure that quality is maintained throughout the pipeline of your collaboration?
Okay. So we have a team of general practitioners, family physicians, specialists in various fields, nurses, physiotherapists. We have care aides or personal care attendants. The whole team, when we hire personnel to work with us, we always in-service them, let them know what our goals are, what the values, what values eDoc has, and we also, from time to time, make sure that we review what is happening with our clients in the field. So I, as medical director specifically, will handpick or randomly pick some clients and actually do follow-up calls with them. I'll call and ask how they're doing, how they found the service, if they have any concerns, etc. This, bearing in mind the personnel that go out in the field are aware that this happens. So this sort of encourages them to maintain what we have told them that we expect. We tell them we want you to keep time. We don't want a patient to be told you're coming at 10 a.m. and you get there at 11 a.m. Sorry. So they maintain time because they know that there's a feedback mechanism. And if they are slacking, then we'll have a discussion about that. And I'm happy to say that so far we've had a very good rapport with our staff, and our staff are maintaining the values that we've put forward in front of them.
So let's talk about the staff a little bit, because
Mhm.
I think it's very, very essential, especially when it comes to care provision, right?
Mhm.
At the moment, what is the total composition like for the staff that work with eDoc, from nurses to care providers to family care physicians, and what are the level of this staff in general? And I think the reason why I want you to throw light on this. At Flurry, we understand the value, but because we want to be able to ensure that our listeners, especially people living overseas, understand just how much value of work and professionalism is put into the work you're doing at eDoc. It provides that
Mhm.
calm and peace of mind, which we are all trying to achieve.
Okay. So you're asking me for the numbers of staff
So,
or the complement?
yes, the,
The
the
complement.
compliment, yes.
Okay. Okay. So as I mentioned earlier, the team is made up of the four directors who oversee the different aspects of care that we're providing. So our nursing director is a registered nurse herself. She's currently working as a registered nurse, but in management. Our medical director is a physician. Our managing director is a physician, and then myself as a medical director, I'm also a family physician. The director of administration is someone with a very strong background in finance and in administration generally. So he oversees a lot of our staff. The other key player in our team is a medical office assistant or administrator. This is the person that answers phones, takes calls from patients or queries, coordinates schedules for patients as well as for staff, takes care a little bit with the financial component, of course, payroll, etc. But she's the kind of the hub of the organization in terms of day-to-day running. As far as the staff themselves, we have general practitioners, so providing general care to all ages. We have family physicians that provide general care in acute situations, but also provide longitudinal care. So family physicians will take on a patient plus or minus their family long term so that they develop a relationship with the patient. The patient knows their doctor, the doctor knows their patient, and when you have a relationship like that, it's more effective in terms of care, but also preventive measures health-wise. So we have family physicians that provide that care. And then as far as specialists, we have an oncologist that looks after our cancer patients or answers questions about cancer. Oncology is a field that's not very well staffed in Zambia, I think in the world generally, but we're privileged to have an oncologist that we reach out to and a second oncologist for backup. We have internal medicine specialists. We have cardiologists that looks after patients with hypertension, heart disease, heart failure, etc. We also have general surgeon on the team. So any surgical cases, we refer to our general surgeons. We have a pediatrician. Again, pediatricians are not easy to have, but we managed to secure someone. So our little ones are well taken care of. If us general practitioners can't cope or feel we need an opinion, our pediatrician will step in and take care of them. So, and then we also have, I shouldn't forget, we have obstetrics and gynecology. A big field, a big need, we're covered with that as well. So that's the physician component. Aside from physicians, we have a team of good physiotherapists. The physiotherapists are both male and female. We have situations where patients request a particular physio, whether female or male, for various reasons. We can deal with that. And the physiotherapists have different strengths as well. So some of them are very well versed in conditions like stroke or cerebral palsy. So, and then some are more well versed in trauma. So we try to match the request for service with the type of therapist that's most proficient. Aside from physiotherapists, we also have nurses, registered nurses, nurses who have training in midwifery. So we do mother and child care through those nurses. We have nurses who are proficient in surgical nursing as well. And then we have personal care attendants who help the nurses, but also help us when patients need care in the community. Somebody that's isolated and alone, and somebody that needs checking on once in a while, or needs bathing, turning, feeding, that sort of thing. So that's what our team comprises of.
So it's presented a very uniquely 60 case, right? So I can only sit here and then imagine the impact eDoc have had in the general Zambia medical community. So can you share maybe a little bit about that journey? Because I know you started off just after COVID. Well, primarily because of what was happening during COVID, and now you're growing at this space. You're still here. People are still you for a lot of support. What has the impact? What does the impact look like, especially in that community? Because I can only honestly imagine the massive impact. A lot of private practitioners themselves will probably want to work with eDoc. What does that mean for even government operations themselves, who needs extra hands? How is the general impact on the ecosystem looking like?
It's been exciting. The beginning, of course, was a little rocky. Telemedicine, to some degree, home health services was something that was new in our communities. So, you know, sometimes when something is new, it's a bit of a challenge to introduce it and actually convince people that actually it is a service that's worth seeking. And so we found that more and more as we go along, more people are now reaching out, more people are receptive to the fact that you can actually get quality healthcare without actually going to a facility like a brick and mortar clinic or a hospital. Of course, within reason, because there are times when home health isn't enough, telemedicine isn't enough, and we are trained to recognize those situations and actually advise the client that they need to seek help from a facility. So it's been exciting. It was slow, but it's picking up. We also find that there's a lot of positive stories that have come out of the service that we're giving, and that has been very encouraging. We've seen situations where, you know, an individual's life has been changed so dramatically, and they're coming back to us and saying, I can't believe it. This is something that I couldn't access, or I didn't know I could access, and look at the change that it has made in my life. So that's a very exciting thing that we've seen quite often now, and that's what's encouraging ourselves as directors as well as the staff to keep going at it. And I think talking to the medical fraternity as a whole, we're realizing that it's not just us that have this vision for telemedicine or for home health services in Zambia. Our colleagues are also getting on board. Recently, we had a medical association conference here in Zambia in August. One of the subjects was actually, or the topics that were discussed was digital medicine, how to advance it, how to provide it in Zambia. And coincidentally, today, our president, Mr. Hichilema, the Republican president, was at a conference, and he was talking about digitalization of the government, not just in Zambia, but in African governments as well. So it's exciting the way this thing is taking off, and it's exciting to be a part of it. Yeah.
Yeah, because I mean, the truth is, if you are ever going to be able to achieve that universal healthcare, especially at scale, and taking into consideration quality and cost, we have to
Mm-hmm.
be able to open the space up to technology. The use of telemedicine, for example, will actually play a huge impact in that. So I have a question that I've just come in from LinkedIn from Bright. He's asking a question on emergency services. So I'm just going to read that. So he said, say you have a patient you're managing and they suddenly go into an emergency while the primary care has left the home. Are there plans on ground for emergency care for these patients in such situations? Also, say a certain condition can't be managed at home due to lack of the appropriate facility at home, like a physio lab. What do you do since you mentioned this earlier on?
Okay, thanks for the question, Mr. Bright. The first component of your question, we the type of care that we're providing and the type of personnel that are going out into the homes are trained to assess the patient holistically when they get to the home. So, for example, if a patient has requested maybe removal of stitches, they were discharged from hospital a week ago, they have stitches from surgery, and the appointment that they requested was to have stitches removed by the nurse. When the nurse goes in, she doesn't directly go in and start attending to the wound. The first thing every provider does is to check the patient as a whole. We eyeball them, we do vital signs, and see how stable the patient is overall. In so doing, we avoid or hopefully avoid situations where once we deliver care, we turn around and leave and the patient declines to such a degree that they need emergency care. When the caregiver is in the home, they do that thorough assessment before commencing the reason for their visit. And if at the time that they do the assessment, they notice any discrepancy in the vital signs or in the way the patient appears or the way they're speaking, we actually have a system in place where that care provider will call their immediate supervisor. So if it's a physician, they will likely initiate transfer of that patient to a facility, for instance, if they're that dire. But if they're not, and the physician wants to speak to a specialist, for instance, they will immediately then call the specialist who's available, discuss the situation, get advice, and implement care. If it's a nurse, the same thing. The nurses will call the doctor who's on call. We always have one person on call and discuss the situation and make sure that they stabilize that patient in the home. If that patient cannot be stabilized, the condition meets a higher level of care, we have trained our staff to discuss with the patient or the relative in the home and explain that they need to be moved. And we ask them for permission whether to call an ambulance that is government funded, whether it's a private ambulance, etc. And then we send them to the collaborating facility without delay. So we don't expect a situation where we'll leave the home and the patient collapses behind us, because that's the type of care we give. We don't overlook general condition of a patient. Yeah.
So I'm just going to come in with a very interesting, and this is a lived experience, right? So
Yeah.
my auntie, I always use her as an example. So she's
Okay.
based in Sierra Leone, but she's one of the most stubborn people you ever meet.
Mm.
Is very typical, and she's overly sensitive of who provides care to
Mhm.
them, right? So how do you mitigate or manage, or what are some of the ways, if there is an example you can provide, wherein that type of patient, the difficult patient who is very, like I said, sensitive about who is providing that care, because
Mm-hmm.
when someone is going into the hospital, into the facility, is different from when you are in their home. It
Yes.
can be a little bit different. It can be a little bit tricky. So how do you manage that to ensure that the same level of comfort is provided, but also the same level of trust that the caregiver is providing the best care for them, even while they're at home, is maintained?
Mhm. I think that goes down to training and frequent review of what we're doing in the community. The experience of patients requesting particular providers or particular types of providers, that is something that's not just unique to home health care, but it happens in hospitals, as you stated, or in clinics. So with eDoc Healthcare Services, we recognize that. And when patients are being scheduled, our scheduler will always ask what patient's preferences are. A lot of times we get a request for a female physiotherapist specifically or a female GP. And we recognize that that is something that if we can provide that, it gives you that trust from the beginning when you go in to see the patient. And it also helps you to achieve what you're there for. Your assessment will be more informative. Your treatment will also have better results if the patient is content. So we always take that, put that in place before we actually go into the home. If for some reason the provider that they prefer is not available that day, we will always mention that the female physio is not available. She's fully booked today. Would you mind a male physio? Or the same with nursing, and the patient will express that to us. Should they refuse, I don't think we can put too much pressure on them, but we will explain, especially if it's an urgent case, that you're better off being seen, and the person that will come in will treat you with respect. Hopefully, the patient will agree to have that caregiver come in for them. Yeah.
No, thank you very much for that. We're about to come to a close now, so I still do have a few questions. I think two or three questions more for you, but I just wanted to take this time out to say for all of you who have tuning tonight on the Flurry Care Digest, thank you so much for being here. Thank you for sending in your questions. You can always reach out to us. Reach out to us if you want to get to eDoc and you're living wherever you're living and you will have family in Zambia and you want to ensure that they have the right care, you can come through the Flurry Care at the Flurry platform and then be able to have eDoc provide you with that support that you need. So I think the question that I have two questions really. So the first one is, why do you think immigrants? So you and I have actually been in this. You've been in
Mm-hmm.
this position before. Why do you think immigrants should value the relationship that eDoc and Fleury have signed today?
Why immigrants should value it. Peace of mind. Uh, the partnership that Fleury and eDoc have today, if an immigrant actually takes advantage of this partnership, you'll be assured of peace of mind as far as family or friends are concerned back home. Like I mentioned earlier, I've experienced it myself. It is very stressful. You can't focus on work. You can't focus on your social life or your family if you're worrying about a loved one back home. This partnership that we have, I'd encourage people to explore it and take advantage of it because it's going to assure you affordable but quality healthcare for your loved ones. And with the permission of your loved ones, you will actually get feedback in a very timely manner as far as what is happening with your loved ones and what interventions are needed and what can be put in place. Because we find that that's a very big gap in healthcare provision a lot of times where a patient is seen, the family is kind of out of the loop and the patient isn't able to explain what is going on. But if a patient gives us permission, trust me, you'll be made aware of what's going on, what needs to be done, when, etc., etc. So I think the big thing is that it gives you peace of mind. And the other thing is affordability. Sometimes I've been victim to that. You get a message, somebody's not well, you send a bunch of money and hope that what will be done will achieve what you want, improve that patient's health. But instead, people not really misappropriate it, but they don't know how to get those services they need. Before you know it, there's another request. Oh, we went for a CT scan. Now we have to go back and get it read, and we need more money. When you work with eDoc through Flurry, you'll get a more seamless delivery of healthcare for your loved ones. You will know upfront the financial implications of that request that you've made. So it's easier to manage that patient in back home while you're in the diaspora. Yeah.
What is the future of eDoc in terms of just expansion? Because I'm thinking with such a service and the groundwork that you put, the passion and the heart that you put into it, and also specifically, I'm sorry to keep referencing your immigrant days, but specifically you understanding the very need that Flurry is trying to solve in collaboration with eDoc. What is your
Mhm.
future plans for expansion? What is the future? What does that future looks like?
The big thing now is being a young company and having realized that this service there's a lot of potential. What our vision is now to expand. We are based in Lusaka, but we want to expand to the Copperbelt. We're getting frequent calls requesting for service on the Copperbelt province, which is a major industrial hub in Zambia. Our next thing on the agenda is to expand to the Copperbelt, but not just to the Copperbelt. We want to expand to the whole of Zambia. We want to provide services to people in more remote areas. Telemedicine is something that's real, that's effective, and if we can provide those services to people, why not? We want to open another office. Our office currently is in Lusaka, but we want to open an office on the Copperbelt to administer to be the administrative office for the Copperbelt, but we also want to open offices in the major cities in the other provinces. And then long term, there's this thing in the horizon where we think we can expand even out of Zambia. There's no need for us to limit ourselves. There are other countries that need this service that haven't yet been offered the opportunity. So we want to expand to those countries as well.
Well, there you have it. For those of
Mhm.
you who have had the privilege to listen to us have this wonderful conversation with Dr. Vera, we are grateful. We thank you. So, Flurry Care Digest is a conversation that is brought to you by Flurry, a dedicated service that actually allows members in the diaspora to be able to take care of their family back home through healthcare marketplace that have partners as amazing as eDoc and the entire team at eDoc. So today we cover not only Zambia but other multiple other countries. So do feel free to check us out at joinflurry.com. And until next time, I've been your host, Sidi Sakor, the Chief Operating Officer here at Flurry, and I've been joined by the wonderful Madam Dr. Vera. Thank
Thank you.
Do you have any last statement? Any last? In fact, I'm going to say number one, how important is health, and number two, how important is peace of mind. For one is for people, the immigrants, and then the other is for people back home. What will be your take as your last word?
Like I said, for the immigrant, life is not, depending on the reasons for being an immigrant, life can be good, but there's always that part where it becomes hard when your heart is being wrenched at because a loved one at home is experiencing health issues and you cannot intervene in the way that you want to. That's one big thing. So mental health is impacted, your physical health, your social health is impacted as an immigrant. If you have family or friends that you cannot help health-wise back home. So big thing. Reach out to Flurry. This is a good vehicle, if I can call it that you can utilize to help you get that peace of mind. Peace of mind is a big thing. We talk about health overall. It's not just physical health, it's mental health as well. So peace of mind is mental health. If my mental health is off, I cannot execute my day-to-day routines with my family, at work, etc. So get that peace of mind, get mental health, get your physical health by making sure that you have some sort of mechanism to help you care for your loved ones back home. And like I said, Flurry is there for you. Yeah.
Thank you so much. And also, eDoc is also here for you because they are our amazing partner in Zambia. So thank you so much. Until next time, good night, everyone, and we'll meet again soon.
Thank you, CD, and thank you everyone for joining us.